Alright, everybody. So today we're going to talk about our client, Harold. Harold is a 45-year-old male who's about 5'7", coming in at about 265 pounds, which converts to about 120.45 kilograms. Harold has a chest that's about 40 inches in circumference and a waist that's about 42 inches in circumference. Harold has a resting blood pressure of about 139/90. And Harold has a resting heart rate that comes out to about 119 beats per minute. Harold has an age predicted heart rate max of 175 beats per minute. And Harold does have CHD risk factors, including his age, because he is equal to 45, which increases his risk. His almost sedentary lifestyle, because he only rides his bike to and from work about 3 days a week, equating to about 3 miles per week. His almost obesity, because Harold does have a larger waist circumference than what is considered healthy, and his also almost hypertension. Harold does have a diastolic blood pressure that is equal to 90, which does consider him hypertensive and does increase his risk for CHD. Additionally, special considerations for Harold: he does have type 2 diabetes and is on medication for that, so that is something to consider when developing his program. Harold also does have occasional heart dysrhythmia and is on medication for that as well, so that is additionally something to consider. And overall, Harold is just in pretty poor health, so that's, again, something to really consider when developing his program. According to the ACSM, the running model, using a speed of about 147.4 meters per minute and a grade of about 0.02, Harold's estimated VO2 max comes out to about 35.63 milliliters per kilogram per minute, and this reflects a poor VO2 max, which isn't any surprise considering his other vitals and measurements. Harold is definitely not in very good health right now. Additionally, his current BMI is at a 36, but his desired BMI is at a 29. So we're going to get him there. So now we're going to take a look at Harold's PARQ plus. The first 7 questions. So question 1, has your doctor ever said that you have a heart condition or high blood pressure? Harold did come to us saying that he had an occasional heart dysrhythmia, so we're going to go ahead and mark yes and mark heart condition. 2, do you feel pain in your chest at rest during your daily activities of living or when you do physical activity? Harold never mentioned any of this, so we're going to go ahead and mark no. 3, do you lose balance because of dizziness or have you lost consciousness in the last 12 months? Again, Harold never mentioned anything like this, so we're going to go ahead and mark no. 4, have you ever been diagnosed with another chronic medical condition other than heart disease or high blood pressure? Harold did come to us saying that he had type 2 diabetes, so we're going to go ahead and mark yes, and typically a patient would list that in this little line right here. 5, are you currently taking prescribed medications for a chronic medical condition? Harold did mention that he's taking medication for his type 2 diabetes, so we're going to go ahead and mark yes. And question 6, do you currently have or had within the past 12 months a bone, joint, or soft tissue problem that could be made worse by becoming more physically active? Harold never mentioned anything of this, so we're going to go ahead and mark no. And 7, has your doctor ever said that you should only do medically supervised physical activity? Again, never mentioned, so we're going to mark no. So because we didn't answer no to all of these questions, we're going to go ahead and have to answer follow-up PARQ plus questions, which we'll go over right now. So here are Harold's follow-up questions. Question 1, do you have arthritis, osteoporosis, or back problems? Harold never said anything, so we're going to put no. Question 2, do you currently have cancer of any kind? Again, Harold never said anything, so we're going to put no. Question 3, do you have a heart or cardiovascular condition? Harold does have an occasional heart dysrhythmia, so we're going to go ahead and answer the following questions. 3A, do you have difficulty controlling your condition with medications? We're going to go ahead and put no. Harold never mentioned anything of this. 3B, do you have an irregular heartbeat that requires medical management? Harold does take medication for his occasional heart dysrhythmia, so we're going to put yes. 3C, do you have a chronic heart failure? Harold never mentioned anything, so we're going to put no. 3D, do you have diagnosed CVD and have not participated in regular physical activity in the last 2 months? Harold never mentioned, so we're going to put no. 4. Do you currently have high blood pressure? Harold never reported this, but his vitals did show that he does have a high diastolic blood pressure. So we're going to answer the following questions. Do you have difficulty controlling your condition with medications? Harold doesn't take medications, so we're going to put no. 4B, do you have a resting blood pressure equal to or greater than 160/90? Harold does have a diastolic blood pressure of 90, so we're going to go ahead and put yes. 5. Do you have any metabolic conditions? Harold does have type 2 diabetes, so we're going to answer the following questions. 5A, do you have any difficulty controlling your blood sugar levels? Harold does not have this difficulty, so we're going to go ahead and put no. 5B, do you often suffer from signs and symptoms of low blood sugar? Again, Harold doesn't have this issue, so we're going to put no. 5C, do you have any signs or symptoms of diabetes complications? Harold never mentioned anything of this, so we're going to go ahead and put no. 5D, do you have any other metabolic conditions? Harold never mentioned anything, so again, no. And 5E, are you planning to engage in what for you is unusually high intensity exercise in the near future? And because Harold is participating in this program, we're going to go ahead and put yes. Question 6. Do you have any mental health problems or learning difficulties? Harold never mentioned anything, so we're going to answer no. Question 7. Do you have a respiratory disease? Again, Harold never mentioned anything, so the answer is going to be no. Question 8. Do you have a spinal cord injury? Harold never mentioned anything, so we're going to answer no. Question 9. Have you had a stroke? Again, Harold never mentioned anything, so we're going to answer no. Question 10. Do you have any other medical condition not listed above, or do you have 2 or more medical conditions? Harold does have 2 medical conditions, so we're going to answer the following questions. Question 10A is a no. Question 10B is a no. Question 10C is a yes, and the medical conditions he lives with are type 2 diabetes and a heart dysrhythmia. So after taking a look at Harold's PARQ+, we're going to need medical clearance in order to continue with this program. Just based on that PARQ+ alone, him answering yes to those questions, we're going to need clearance from a doctor in order to continue his program. Okay, so after taking a look at the PARQ+, we're going to go ahead and take a look at Harold's ACSM algorithm. Basically, it starts with a question: does the individual currently exercise regularly? Harold does not, so we're going to answer no, which brings us to the following question: does he have cardiovascular, metabolic, or renal disease? Harold does have type 2 diabetes, which is a metabolic disease, so we're going to answer yes, which brings us to the next box, which says medical clearance recommended. So after taking a look at Harold's PARQ+ and his ACSM algorithm, both of them came back showing that Harold should seek medical clearance before continuing with this program. Even though his type 2 diabetes and his heart dysrhythmia doesn't seem to affect him very much, they are 2 medical conditions that can become concerning when you alter your physical activity in the way that he's about to. So we're going to go ahead and want him to make sure that it's all good with his doctor, and then we can proceed with the program.